Oh,
Sorry.
okay.
Good morning, everybody. It is a pleasure being here, joined by the governor and everybody else. My name is Assaad Sayah. I am the CEO of the Cambridge Health Alliance and the Commissioner of Public Health for the City of Cambridge. Cambridge Health Alliance serves many of the communities that have been hardest hit during COVID-19 pandemic. Over the past year, our staff and providers have worked around the clock, treating, testing, and now vaccinating the members of our communities. A key piece of our mission is to advance health equity and address the social determinants of health. The work with local public health departments, schools, civic, cultural, and faith-based community organizations to develop initiatives and programs to promote health equity, improve community health, and impact public policy. This week, as announced Monday by Governor Baker, we're pleased to take part in the launch of the Metro North COVID-19 Vaccination Partnership. A consortium of 9 cities, Cambridge Health Alliance, and Tufts University will operate 3 joint vaccination sites to expand COVID-19 vaccine access to the Metro North area. These sites are at the Gancher Center at Tufts, Cambridge Health Alliance Vaccination Center at Somerville, and here at Encore Boston Harbor, with Cambridge Health Alliance serving as the health provider of all sites. Thank you to the Metropolitan Area Planning Council for helping to coordinate this effort among the 9 communities from Arlington to Revere. This is an exciting opportunity to expand access to COVID-19 vaccine near and around the communities that we serve, and these are the communities that were hardest hit by this pandemic. This is aligned with the Commonwealth targeted community-based approach to help break down the barriers to vaccine access and increase vaccine equity by reducing travel, language, and mobility challenges. As a physician and a provider and a healthcare executive, I'd like to encourage everybody to get vaccinated. This is absolutely critical to our ability to fight this pandemic and get beyond it. We need everybody's involvement in the communities and beyond to encourage everybody to get vaccinated, because that's the only way we can get past and beyond this. We're also in the process of launching a mobile vaccination program as part of this collaborative, starting with communities that are hardest hit. We're reaching out to faith-based organizations and other community networks to provide vaccine where it's most needed. Let me start by saying thank you to Secretary Sudders for the collaboration and the partnership. You have been amazing. Your department and staff have been great, and our partnership has been very important in getting these sites up and running. And I know we partnered on a ton more than this. As we stand here today at Encore, I want to extend my thanks to Brian Gullbrants, President of the Encore Boston Harbor, and Carlo Di Maria, Mayor of the City of Everett, and everyone in the Metro North COVID-19 Vaccination Partnership for their collaboration as we work to get past this crisis. It takes an enormous collective effort to make everything come together. I'd like to welcome Governor Baker, Lieutenant Governor Polito, Secretary Sudders, Mayor Di Maria, Senator Di Domenico, Representative McGonigal, and most importantly, our mayor, for really their hospitality and the work that we do here every day. I also like to welcome all the dignitaries and recognize our Vice Chair of the Board, Bill Leahy. And for now, Mr. Governor, please.
Good afternoon, and thank you very much, Doctor, for your leadership
throughout the course of this pandemic. And for those of you who haven't been able to spot Representative Joe McGonigal, it's because he shaved his head for a very good cause, but he's actually sitting right there. And brother, I just want to thank you for jumping in and giving up one of our most precious assets. And Mayor, it's always good to see you, and we appreciate the work we've done with you all the way back to the beginning of this whole thing, and the same goes for you, Senator. We've talked many times on many issues about COVID in your district and in your communities that you serve as well. And I also want to thank Brian and the folks on Encore for providing us with what is by far and away the most over-the-top, beautiful vaccine site we've got. I just don't see a lot of those day in and day out. Let me give a quick update on some of our daily numbers. Yesterday, the Department of Public Health reported 718 new COVID-19 cases out of about 36,000 tests. We've reported over 21.5 million tests so far. 516 individuals are in the hospital and 136 are in the ICU. On vaccines in total, about 2.6 million people in Massachusetts are fully vaccinated, and around 3.9 people are either fully or partially vaccinated. We'll be over 4 million any minute on that one. This week, we're distributing more vaccines to providers across the Commonwealth. We received about 380,000 first and second doses as part of our state allocation. About 150,000 doses are being provided to hospitals and health systems. Over 90,000 are being sent to regional collaboratives and local boards of health. Mass vaccination sites are receiving about 118,000 doses. Community health centers are receiving about 12,000 doses from the state. They continue to get doses as well from the feds. Retail pharmacies are receiving about 130,000 doses from the feds and a small piece, about 3,500 from the state. We continue to lead the nation with respect to vaccine distribution. We're number one in administering both first and second doses per capita among all states that have more than 5 million people, and we're number two in the nation in terms of total doses administered to adults per capita. Yesterday, I think many of you know, President Biden announced a goal of getting 70% of Americans at least one dose by the 4th of July. Here in Massachusetts, thanks to the ton of work that was done by so many, we've already surpassed that milestone and look forward to working with all of our partners to make even more progress in the weeks ahead. Massachusetts is also extremely successful at getting residents to return for a second dose. And this is a big high five to all the folks who've been part of this program, and especially to those who are getting vaccinated. Over 99% of the people in Massachusetts who get a first dose get their second dose. That is significantly above the national statistics. All of these factors mean that Massachusetts is on track to meet the goal we set back in December of vaccinating over 4 million people. We're set to hit this milestone by the beginning of June. We have some of the lowest vaccine hesitancy rates in the country, but still, we want to provide more opportunities for people to conveniently get access to the vaccine wherever they might be and in whatever community they might live in. It's also easier to find available appointments now. If you're someone who's been waiting to book because of the crowds, please go to vaxfinder.mass.gov. You'll be able to find an open appointment somewhere near you. There are over 800 sites available statewide. And as we all know, the vaccine is safe, effective, and it's free. It's been rigorously tested, and millions of people have received the vaccine, and we have an enormous amount of evidence available at this point to show that it is, in fact, safe and effective. One really look no further than the data for our most vulnerable senior citizens here in Massachusetts. The fact that over 85% of everybody over the age of 75 has been vaccinated in Massachusetts, and such a significant portion of the folks in our long-term care facilities, both residents and staff, have been vaccinated, has played out in all of our data since that process began in December. Those most senior among us are no longer the folks who are being counted in our case counts, ending up hospitalized or fighting for their lives for the most part. It's been an extraordinary process to watch play out in real time as a real-life demonstration here in the Commonwealth. And now that vaccines are becoming more widely available, we're shifting our efforts to focus on more targeted community-based outreach. Vaccine clinics like this one here at Encore are a great example of this targeted strategy. Sites operated, as the doctor said, by Metro North Regional Collaborative, which has also stood up 2 additional locations in Somerville and Medford. The collaborative itself serves 9 communities, 4 of which are part of our 20 most disproportionately impacted communities. On Monday, we announced that the state would go forward and double the amount of vaccine that's available to these 20 communities to help get more vaccine deeper into these communities with more access points. I want to thank the municipal leaders from each of these communities who are represented as part of this collaborative. Special tip of the hat to the host community here with Mayor DeMaria. We'll continue to boost efforts to expand our mobile approach to this as well, and also more walk-up and walk-in clinics. Mobile units have played a key role in many of our equity policies so far, and about 61% of the folks who've been vaccinated through those mobile clinics have been people of color. We also plan to increase access to walk-up sites. Beginning next Monday, 6 of our mass vaccination sites will also offer walk-up vaccinations, which will be the Hynes Convention Center, the Reggie Lewis Center in Roxbury, the Doubletree in Danvers, the former Circuit City in Dartmouth, and the Eastfield Mall in Springfield, and the Natick Mall. People can still go to the vaxfinder.mass.gov to either schedule an appointment or learn about some of the walk-up opportunities. And later today, VaxFinder will be listing for each of those locations what the hours are and other details associated with pursuing walk-up appointments. 4 of the state's mass vaccination sites will ramp down later in June. The sites will stay open to make sure that everyone who got their first dose can come back and get a second. But for now, we continue to close in on that goal of getting 4 million people done, and they'll continue to play an important role, especially in vaccinating people who've already received 1 dose. The walk-up option will certainly make it easier for people to access vaccines. What was it you said? You had 30 or 40 appointments scheduled, 700 people walked in? If that's any indication, this could be a great new chapter to the program overall. And paired with that targeted community-based effort that we're pursuing, like this one here at Encore, we should be able to reach many more of our residents and build on the national leading success we've had in distributing vaccines so far, which will help us further reopen our economy, protect our communities, and fundamentally provide a safe solution to so many people here in Massachusetts so that we can get back to normal. And with that, I will turn it over to Secretary Sudders.
Governor, Lieutenant Governor Assaad, Mayor, thank you for having us today. And I have to say, this is really the most amazing chandelier I've ever seen. But more important, I just really want to give a shout out to Encore for opening your door for us to have a vaccine program here. So I just really want to thank you for that. And just a shout out to Assaad and the team at the Cambridge Health Alliance. On Saturday, I actually popped into one of the Cambridge pop-up sites, which is in a church, just to thank the staff for what they were doing on a pretty nice Saturday, putting shots into people's arms. So it's truly a true community collective experience. Just a couple of comments about our continued work around vaccine equity. So we continue with the communities hardest hit by COVID-19 to increase awareness and acceptance of the vaccine, expand access to vaccination locations, and boost vaccine administration rates. I want to assure all of you, while we do this work, our wastage of vaccines continues to be one of the lowest in the country at 0.085%. So even the more as we go out to multiple sites, we are getting every shot into people's arms. This approach is driven by community needs and the community's voice. We're centered on the concept of equity, which is a core pillar of the state's vaccine distribution plan. It's been informed by the state's COVID-19 Health Equity Advisory Group and our Vaccine Advisory Group. As we move into this next phase of vaccine distribution, we will continue to strengthen our outreach and increase resources to our communities to ensure we make contact with under-resourced people and reduce barriers to getting the vaccine. Everett specifically, with the mayor's leadership. City leadership and public health officials are working with one of our providers, ASG, and to expand reach to Spanish and Portuguese-speaking populations. Everett, as with our other priority communities across the state, also has its own dedicated community liaison from the Department of Public Health, working directly with all players to listen intently and to respond to the City of Everett's needs. Everett has a team of 15 trained residents, community residents, who are helping increase vaccine trust and facilitate appointment registration. I understand they knocked on Senator DiDomenico's door the other day in their own neighborhoods through one-to-one conversations and providing referrals for vaccine. These community teams have knocked on over 3,000 doors and made 2,000 plus phone calls to Everett residents alone, encouraging them to get the vaccine. They've hosted 16 visibility events and handed out more than 2,000 brochures and flyers. This week, there's 5 scheduled. This is like political canvassing, except it's vaccine canvassing. There are 5 scheduled door knocking events and 3 events scheduled across Everett to increase vaccine awareness. The city receives 400 doses weekly just for the city's use, specifically to focus on targeting vulnerable populations for vaccine. And as you heard, we are now doubling the availability of vaccines for each of our equity communities. And to date, Everett, just the city, has received 5,600 doses through the equity initiative. It's very different than what is coming to Assaad for the regional collaborative. The local Board of Health in Everett has received over $200,000 in funding resources aimed at meeting immediate personnel and equipment needs as defined by the city to respond to the pandemic, as well as coordination and support for vaccine clinics. Also in Everett, over $450,000 in funding has been awarded to local organizations for tailored community and faith-based outreach and education. It includes supports to raise awareness, strategies to minimize the spread of COVID-19 and increase vaccination confidence. The organizations include the Everett Haitian Community Center, the Mass Alliance Gesundheit, Mass Alliance of Portuguese Speakers, the Somali Parents of Advocates Center for Education, the International Institute, and Latinos Unidos. Through the Commonwealth's investment with our community partners in vaccine access and administration in community settings, Cambridge Health Alliance has also received $350,000 to expand vaccination infrastructure, building the capacity at community health centers. The funding is intended to increase community-based access to COVID-19 vaccination. The operations on site today are part of the Metro North Regional Collaborative. And again, I want to give a shout out for the fact that Cambridge Health Alliance has never wasted one dose. That is pretty amazing. So, the Metro North Regional Collaborative will receive 2,340 doses, 2 trays of Pfizer weekly, and the new doses add to Cambridge Health Alliance existing weekly allocation of a little bit more than 3,500. So starting this week, you will begin to receive 5,850 doses, and I know you will get every one of those shot doses into someone's arm. I know. And with that, I'll turn it back to the governor.
Questions?
Governor, are there any updates at all on plans for delivering shots to potentially children, school children, now that you know that, the vaccine for ages 12 to 15 could be approved within a few days next week?
There are conversations going on about how to vaccinate younger kids as and when they become eligible. But the rules and the guidance on that are going to be a function of when the feds decide to make a decision and how they decide to pursue that going forward. This topic came up on the call with the governors yesterday, and the feds were very clear to us that until decisions are made by the review board, they won't be delivering any kind of information to us around distribution protocols or that type of thing. They're not going to get ahead of the review process, in other words. So we're waiting to hear from them.
And you're still considering requiring
look, we're going to wait and see what guidance we get from the feds. We're going to wait and see where we are with respect to COVID generally. I'm much happier pursuing incentive policies and making it more available and encouraging people to get it. I've said that many times before. And I think we're a long way away from making a decision about that.
If 12 to 16-year-olds are allowed to get the shot, is that going to revise your 4.1 million number? Do you want to see that number go higher? What would it be?
I think there are are there 450,000 plus or minus?
About 410.
410, roughly 400,000 people in that category. We'd certainly incorporate them into our stretch goals, absolutely.
Governor, are walk-up appointments happening already at some of the mass vaccination sites? We've seen some Twitter traffic that, for instance, at the Hynes, people are walking up today.
There's walk-up traffic going on in a bunch of different locations. Some of the pop-ups, in fact, a lot of the pop-ups have been operating with walk-up traffic for a while. And I think what you'll see is just an expansion of the existing walk-up stuff as we go forward.
And this will be at all the mass vaccination sites?
Yeah.
You listed them all. One more question about this being at a casino and being creatively trying to get into the community. Is there any outreach to the gamblers, tossing the dice, that maybe it'd be a good time to get a shot on the way out?
I actually don't know the answer to that one. Are you guys?
Whatever works.
Yeah. I mean, there's certainly no doubt that it's here. I mean, people know that this site is up and available to people. Yeah.
A lot of places are doing incentives now, obviously, to get people to come. This certainly would be a good incentive.
How about a $5 chip?
We can break it down into what I have
We have not had here in Massachusetts some of the issues they've had in other parts of the country with just getting people interested in getting dosed. We'll continue to, what we are going to do is continue to try to make this as readily available as we possibly can to people and see how far we can get with that.
Could I just go back and clarify in terms of the younger kids, adolescents? So what you're saying is you're waiting to hear from the federal government what they're going to recommend and how it's distributed? And that's for the teenagers. I'm wondering, Pfizer's now even saying that 2 years old, people given 2 years old could get vaccinated as well. Would it be two different protocols, do you think, to deal with those two different groups? And again, would it be something that you'd follow from the federal government?
Well, first of all, the federal government gets very nervous when people get too far ahead of what they are actually doing, reviewing, approving, and signing off on. And we got a big dose of that when we were talking to them yesterday. So I would expect and anticipate they will have very little to say about any press release that's issued by any pharma company about wherever they are with respect to their clinical trials. I happen to think that given the nature of the farther and farther down we go on this in terms of the age stuff, we're going to be very interested in the guidance we get from them about what they think the most appropriate protocols are for vaccinating them.
So, Governor, a lot of high school students are eligible for vaccines now. I don't know if you said, but are you considering requiring that run the flu shot for school-age kids, not for adults, for school-age?
No, that's the kind of thing I want guidance from the feds on that stuff before we make decisions about it.
Governor, big announcement from Governor Cuomo. I know you mentioned, Massachusetts isn't seeing a problem really with vaccine uptake, but there is 30% of people out there who haven't had a shot. So he's talking about offering free tickets to like Mets and Yankees games and vaccinated seating. Have you had conversations with the Red Sox or even the Patriots about that sort of thing, offering ticket incentives?
We haven't had conversations with them about that per se. But again, I want to see how far we can get just by doing a better job of making more locations available to people.
Governor, are you resigned to the fact that there's going to be a significant number of people that no matter how many opportunities you present them, they're just not going to get the shot? What's your last ditch effort to reach them?
Well, keep in mind here that 70% of our eligible population, of our adults at this point, have gotten a first shot. 70%. And that doesn't count the hundreds of thousands of people who are scheduled to get a first shot. And I think in Massachusetts, people have demonstrated that they're interested in getting it, and that the network we put together for them, for the most part, is working. I think the most important thing we can do is to remind people over and over again that it is enormously safe, clearly effective, based on just the practical reality of what's happened with respect to the populations that have been vaccinated, both here in Massachusetts and around the country, and that it is in some ways one of the best things you can do to get this state back to normal. And most of the data that we've seen, and we've talked about this, does not suggest there's a big chunk of people in Massachusetts who are absolutely no. There are a lot of people who are wait and see. And the more people we get vaccinated, the more people they know who got vaccinated, the more times they have an opportunity to talk to somebody in the medical community, or to talk to somebody at the church where there's a pop-up, or to talk to folks at some other site or location, or if they see 2 or 3 of these and they see friends of theirs getting it done at pop-up locations, the more likely they'll be to do it. We don't have a big chunk of people who are just flat out no. What we have are a bunch of folks who've basically said, I just don't want to go first. So I don't think we're to the point yet where we're at the end of the line here.
But you've got a goal of 4 million people. Census last week.
I think we're going to make that one.
The census last week said we have 7 million people. That means 3 million people are somewhere in between. Are all those 3 million people?
400,000 of the 7 million, the 3 million that you're talking about are part of that crew that may become eligible, and then a whole bunch of additional fall into the category that gets you down to perhaps the age of 2, if that happens at some point this fall. I mean, at some point, we're also paying a lot of attention to the hospital numbers and the case counts and the other elements that determine the relative presence of this thing here in the Commonwealth. And we're basically going to track all of those numbers. I think we're doing a national leading job on vaccinating people, primarily because we have a lot of great people working both ends of this, the folks who are trying to get vaccinated and the folks who are doing the vaccinating. But I also believe that some of the targeted outreach that's going on here is going to improve our numbers.
Governor, since we're at a casino, is there any update at all on the effort to bring sports book to Massachusetts? Is there something going on behind the scenes with the legislature?
There is definitely discussion going on with and in the legislature about this issue. And Lieutenant Governor and I filed a bill that was built on the New Jersey bill, I think almost 3 years ago now. We certainly support it. Most of the other New England states are engaged in it. Most of the states in the Northeast are engaged in it. And I think it would be an important element for us to make sure, just from a purely competitive point of view, that we do it as well.
So you're expecting some action on it this year?
I think we'll probably get, certainly this session, yeah.
Governor, U.S. Secretary Sudders have both said that there's a very low wastage rate here for vaccine. As we start doing more walk-up clinics, is there more potential for wasted doses, since you won't know exactly how many people are coming in every day? And how do you manage that?
So I'm going to let you take a crack at this, but when they had that day with 40 or 50 appointments and 700 walk-ups, they did not waste a dose, which is quite an accomplishment. So,
Thank you, Governor. The way to do it is logistics, and all centers really know how many people have appointments. And by early in the afternoon, we can predict how many doses we need, so we don't open additional files until the last minute. Now, there are days where we have, by almost the end of the day, a few additional doses that we anticipate. We have a list of folks that are on standby that we could call in to come and get their vaccine at that time. We've been very successful not to waste any doses based on this, and I'm sure a lot of this is the same tactic that's followed by other vaccination sites.
How long does it take, actually, once, say, 500 people walk to this door right now, you needed these doses, you didn't have any, how long would it take for them to call wherever you keep them to get them in the arms?
From the time they show up as walk-in, or from the time they call?
Or from the, well, just say you have 500 people just walk in the door, say,
Right.
You need these vaccines quick. You got to call back to the office or wherever you keep them. How long does that take?
Well, we do have some vaccine on site that we bring that morning. And if we get to a point where we anticipate that the demand is gonna be more than the availability, the hospital is about 3 miles down the street, and we have a pharmacy that's accessible. We do have multiple pharmacies in multiple locations. We also have a pharmacist on site that's tracking all the vaccines and making sure that the appropriate dose is available even before the patient gets here. So we do have all that logistics taken care of.
I guess what I'm wondering is what's the timeline? Does it take, 15 minutes?
Oh,
An hour?
it's about an hour and 20 minutes. Yeah, so, but we're ahead of it most of the time.
Thanks, everyone.
Thank you to Cambridge Health Alliance.
Thank you.